So with regard to community care, a veteran who is in the program, and they end up, they're raking leaves in the backyard with their family, and a whole horde of bees comes out of nowhere and stings them, and they need to go to the emergency room. Ambulance comes and picks them up and everything else. How do they need to go about that process, whether it's informing the VA or what have you?
Right. So that process does differ a little bit from urgent care. So for emergency, obviously, you feel like your life is in danger. You would obviously call 911 or a family member bring you to the nearest emergency room. That does differ from urgent care. So for urgent care, obviously, you don't feel like your life is in danger. You can go there for scrapes, bruises, infections, eye irritation, minor injuries. For emergency, you do not need authorization either. You can absolutely go to your nearest emergency room. The important thing to remember about that is that a loved one, yourself, as well as the community provider, needs to notify your local, needs to notify, we have a new process, the National Call Center within 72 hours of admission. So just letting them know that Joe Smith presented to the ER today and give all the information so that we can make sure that we properly pay that community provider. And more importantly, we can care coordinate. For instance, if you're admitted, normally a loved one or the community provider would contact that national hotline, and then that national call center lets your local VAMC know, and they would pick up the care coordination piece and make sure that you're either transferred back to the VA or, schedule the follow-up appointments. They would care coordinate that entire visit. But that 72-hour notification is key to making sure everything pays smoothly, care coordinates smoothly. So you really want to get your max benefit, you want that 72-hour notification in place, which is a 1-800 number, again, on the community care website. And it doesn't have to be yourself. It can be a loved one, a friend, as long as that notification is made within 72 hours.
Making that notification, though, within 72 hours is not a requirement with urgent care?
It is not. You do not need to notify us for urgent care. Nope. Just the emergency benefit.
So I'm guessing it may be the fact that because wherever they're seeking emergency care is not actually in the system, whereas the urgent care would be in our system and would notify
Correct.
VA that
they have to, because in order to get urgent care, you have to be within the community care network,
right.
In order for that bill to be paid. And yes, they create their own authorizations and work with Optum directly. For emergency, you're going to go to the closest ER that may not be in the VA network. Most of the hospitals are, but also the main piece on the notification is so that we can properly care coordinate from the beginning. But they do give you the 72 hours as far as and to properly get paid and reimbursed for the greatest benefit as well.
The web address that everyone needs to go to?
Yep. So www.va.gov/communitycare. And then from there, there's several resources as far as urgent care, emergency, routine care, claim and billing. Everything is there. So /communitycare.
So to everybody out there, just like Kim said, if you're looking for information with regard to community care, you can check out that URL. And also, if you're looking for more content like this, search #TheSitRep on YouTube and begin connecting with the benefits that you have earned and deserve.